I'm Al Gilbert, President and CEO of Felton Institute. San Francisco Suicide Prevention has merged into Felton Institute. It's a great opportunity for both agencies, as both have historical records, many years in operations of serving people in need. Together, we collectively are looking at how we can enhance the services that both organizations can provide. And additionally, the additional benefit of the merger is that we get to educate each other on the services that are unique to each of the organizations that can support the continuum of care that we use to address the needs of the populations we serve.
I'm Peter Rojo, and I'm on the board of Felton, and I'm also the past recent president of San Francisco Suicide Prevention's Board of Directors. The merger with Felton came about when our executive director planned on retiring. So after 30 years, the board saw that as an opportunity to transform and to grow and really to elevate the work that Eve Meyer has done after her 30 years with San Francisco Suicide Prevention. So when the board was looking at potential partnerships, because we felt that in the mental health services arena, we wanted to make sure that we were able to integrate our services, not only with our hotlines, but with our other programs. So the board decided to look at different agencies that would make great fit. And knowing that Felton, and as a volunteer myself, 20-something years ago, I knew that Family Service Agency, now Felton, was a great partner because of how I was able to refer callers that I had talked to on the suicide hotline to the agency for help. And when the list of potential partners that we reviewed, it was clear that Felton was the best fit because Felton itself has been around for over 100 years, also provides great services, and our unique programs would fit well into the Felton organization.
Felton Institute was founded in 1889, and we took the name of Kitty Felton recently in 2014 because she was our first executive director for the agency and stayed with the agency for about 37 years as its executive director. And during that period, she did a lot of work transforming how systems of care in San Francisco, particularly after the earthquake, and providing services for families in need. And since then, we have merged into an organization now that specializes in mental health services.
San Francisco Suicide Prevention has been around for 57 years. It was founded by Bernard Mays, who's an Anglican priest from Great Britain, who also was a reporter. And he was interested in doing a story in San Francisco because of, at the time, back in 1962, it had the highest rate of suicide in the world. And he himself, who took an interest in helping those who were suffering, not only because of his calling, but because of his activism in that area. He himself founded the Good Samaritan program in Great Britain that provided hotline services there. And so when he asked, oh, what program do you have here? What service do you have here for people who are considering suicide and who would like to reach out or have an opportunity to reach out to someone and talk to them? He was shocked to learn that there was no service at all in San Francisco at that time. So he founded the first ever national suicide prevention hotline, and it's grown into 500, a network of 500 crisis centers in the United States.
The merger with San Francisco Suicide Prevention provides the opportunity for us to continue the strong work that San Francisco Suicide Prevention has provided over the years. And keeping their team together because they do extraordinary work. They have a well-oiled machine. They have hundreds of volunteers that provide support for over 50,000 calls a year. So our goal is to keep that core strong, and to keep the program name intact, keep the team in the same location, but also to expand our opportunity to provide behavioral health services and mental health services to their outreach efforts in supporting the people who are calling in, because many of those people are the same clients that we serve, and having an opportunity to address them in that period of need, in the period of trauma, frustration, when they're deeply considering an act that would not work in their best interest, then that's the opportunity for us to engage our professionals who can then support them in providing the appropriate care at that point.
With the merger, it was an important criteria for the board and for the agency that San Francisco Suicide Prevention's programs and staff partner with an agency like Felton and come over whole. And we wanted to make sure that there was no disruption in our services, which is very important. We run 24/7, 365 days a year. And we want to make sure that our callers were able to continue reaching out as they have in the past. And so Felton's board and leadership was on board in making sure that the important work that we did that was valued with the San Francisco City and County, as well as with our other contracts and partners and stakeholders continue to make sure that we provide the same great level of service that we have been with all of our programs.
For families who are in need or are in crisis or have loved ones and or friends who might need support, I would encourage them to reach out to Felton Institute. One way is through the San Francisco Suicide Prevention Hotline, and you can also contact Felton directly. Don't hesitate to reach out. There are a lot of ways in which people can support you, so bring your challenges to us.
If you're feeling isolated, depressed, lonely, and you're thinking, what more is there for me? Know that for the last 57 years, San Francisco Suicide Prevention has been here. And we want to make sure that we continue to be here. Pick up the phone, call us. Now you can text us. Now you can do our online chat. If you're comfortable with sending an email, if you want to let us know, what's really going on and you want to get deeper, let us know your story. We've been here for a long time. We plan to continue being here for you. And we want to make sure that, if you have a loved one, if you have concerns about a friend, pick up that phone.